Hi, I'm Jessica. I'm the dental concierge at Mod Squad Dental in the office of Dr. Greg Friedman. I wanted to talk to you today about an exciting program that we offer here at Mod Squad Dental, and I wanted to explain the difference between dental insurance and the misconception that patients have about dental insurance. Most of my patients, new patients that I talk to on the phone before they come into practice, I like to explain how dental benefits work. And I say benefits because it's different than medical insurance. And the reason why it's different is because medical insurance, you pay your deductible, and then your medical insurance basically kicks in for their coverage. Dental benefits, they give you a maximum a year that your dental insurance will pay. And that maximum is usually $1,500. So, and they usually have a deductible of $50. Now, you can say mine's better or mine's worse, but they're different options. But for the most part, the most common is a maximum of $1,500 benefit a year, less a $50 deductible. And when I say less a deductible, that means you pay it. So that's $1,450 dental benefit that you get for a calendar year. Now, this is per patient. It's not $1,400 for your whole family. It's per patient, $1,500. But what I like to share with my patients, and the reason I started this in-office Mod Squad Dental Club plan is because I wanted to make today's dentistry, and when I say today's dentistry, I'm talking about the dentistry that we do here at Mod Squad Dental with Dr. Greg Friedman. He uses amazing technology. We have CAD/CAM technology. We use amazing materials. We don't use amalgam fillings any longer, and we haven't for about 15 years. We do composite fillings, which are white fillings. We do all porcelain crowns. So these are the benefits that I wanted every patient and family to be able to afford. Most patients stay away from the dentist if they don't have dental insurance because they're afraid of the cost. Well, I wanted to make that affordable, and I wanted to change that perception from patients and make it so everybody could afford it. And so we started this in-office plan over 2 years ago. It's $199 for the plan. I don't care if you're an adult, if you're a child, it's $199 for the year. And for that $199, you get 2 cleanings, 2 x-rays, and 2 exams. There's some extras that I included, and I'll go over that in a bit, but that's basically all your preventative work that you would need, and that is suggested for an adult or a child over the age of 14. 2 cleanings, right, a year. So, but you invest the $199. You can rejoin every year. There's no hidden cost. It's very simple. I wanted to keep it simple for a reason. Patients can understand it. It's very easy to explain. There's no hidden fees, no hidden cost. You're not going to get slammed with a bill. It's $199, and that's what you get for the $199. Now, we only suggest and take x-rays once a year, but I included that extra x-ray and exam just in case my patients that are members of the club, they get an emergency or they need to come in for an emergency visit. First thing Dr. Fruman's going to do is suggest an x-ray. Well, it's covered. So basically, all your preventative treatment is covered and an emergency visit for that year. You can rejoin every year. Very simple. If you join June 1st, it's good until June 1st of the next year. Now, you also get 15% off of any doctor work done and completed in that year. So basically, it makes patients want to complete their work, which on my end, I want them to do their work, and I want them to do their work when it's first diagnosed. That way, it's less treatment that they're getting done, it's more conservative, and it's less money out of their pocket that they're paying. If you wait for dentistry to bother you or hurt, and when I say bother you, I mean sensitive to hot and cold or pressure, that usually means it's something getting into more serious dental treatment and procedures, which is going to cost you more out of pocket. So that's why I included that in the club plan. Again, you can rejoin every year. There's no sign-up fee, there's no setup fee. You pay the $199 the first time you come in. It's up to you to come in and get your second cleaning during that year, and that's it. The biggest difference is with dental benefits, you get that maximum, but you also invest every single month in a premium. And I've asked most of my patients, which is why I came up with this plan. The premiums are usually, between $30 and $40. We'll add up that $30 and $40 for the year. $30 a month for premiums is $360 that you've invested in premiums for that dental insurance, that you get a maximum of $1,500, less a $50 deductible. So you actually have a benefit of $1,450, less your premium investment of $360, which only gives you a benefit of $1,090. Does that make sense? Now, let's say you go 2 or 3 years without having any dental work done, which most of our patients come here, they take care of their existing decay, and then they're just maintenance after that. Well, if you come here, you take care of your decay and your maintenance after that, you're investing $199 for your preventative treatment for those years that you don't have any doctor work done. With dental insurance, they're collecting your premium whether you're having dental treatment or not. So they're getting that $360 every single year. So basically you just pay $360 for 2 cleanings. So that's why I came up with the plan. Now, the plan has been copied by other offices, and I'm flattered, but they might offer it, and it sounds better on paper or in their plan for I've seen it as low as $30 a month. We'll add up 30, like we just spoke about for your premiums, that's $360. I've seen it as high at some offices, $35 a month, which is $420. So when you're gonna compare my in-office savings plan or club membership to another office, compare apples to apples, your investment, $199, $360, or $420. There you go. Now, I don't have any activation fee. I don't have any cancellation fee. It's flat out. There's no hidden charges. We also include custom whitening trays for you, and bleach for life. And when I say bleach for life, that's your bleach refills. So when you come in once a year to get your x-rays, you ask my front desk Julie for some bleach. She's gonna give you some whitening gel at no cost to you. And that is just what it is. So I've had some of my patients cancel their dental insurance because our offer is better. I've had new patients say, how are you making any money by charging $199 for 2 cleanings, 2 x-rays, and 2 exams? I mean, basically, if you just come in and pay out of pocket for your first visit with us as a new patient, and we do a full comprehensive exam, take a full set of x-rays, and you get a cleaning with one of our hygienists, our out-of-pocket regular cost is $332. So the $199, obviously, if you don't have insurance, is a better plan for you. That's basically a savings for your first visit of 40%. And for your 2 visits over the year for all of your preventative work is 80% savings. So that's a no-brainer. But I do want patients to know dental benefits. It sounds great on paper when you're buying it or purchasing it as well to you as individuals and also to companies. But when you read the fine print, there's a lot of restrictions, and most patients don't even know what their restrictions are. So I would ask you, if you do have dental benefits, check your coverage. Do you have restrictions? How often do they replace fillings? Will they replace a filling if it breaks, 3 years down the road? Know your benefits, because most patients don't. We can educate you on your benefits, and we don't mind doing that, but it's good for you to know, because if you go to an office that doesn't educate you, that's when patients are getting very upset when they get this bill in the mail 5 or 6 months later and they're surprised by it. And the most common restriction, it'll say downgrade for composites on posterior teeth. Well, as a patient, you have no idea what that means, as you shouldn't. You're not a dentist and you don't work in a dental office. But basically what that means is when your insurance sells you a plan and they say you have 80% coverage for basic, fillings fall under basic. So 80% sounds really good, right? But that restriction, downgrade for composites on posterior teeth, that basically means if you're going to an updated office or a private practice office, they don't even offer amalgam fillings any longer. We haven't done them in 15 years. So when they downgrade for composite, which a composite means a white filling, on posterior teeth, that's anything past your canines, which is your pointy tooth in your mouth, where do patients get cavities? On their back teeth, posteriors. So basically they downgrade for white fillings. They'll pay a little bit more if you put silver in there, but that's not even standard of care any longer. So that's what I'm talking about. And do they tell you how much they downgrade? No, they don't. It just says downgrade. We can estimate pretty good how much they're going to downgrade, and it's usually about 10 to 15%. So if they say 80% coverage for basic and you have that restriction of downgrading, you're basically going to get 60 to 65% coverage, not that 80. So it's actually not as good as they sold it to you as. So that's what I'm talking about when I talk about knowing your benefits. So I hope this video helped. I'm super excited about my plan. I love that it's making dentistry today and great dentistry affordable for patients who didn't think that it could be affordable. I think $199 and all of those things included is an amazing offer. So if you have any questions, please give our office a call. If you go to another office and they offer you a plan, get the details, ask about all the restrictions, ask about hidden fees, and just make sure that you know all the details before you sign up for anything like that. So I hope this video helped. I'm super excited, and if you have any questions about the Mod Squad Club Savings Plan, don't hesitate to call. As for myself, Jess, or Julie, who is my front desk business administrator, phone number is 858-547-0070, and thanks for watching.